I was born in Venezuela, and that's Venezuela. That's my little town where I used to practice medicine. And I try to use it as my opening slide because it reminds me, really, why I am doing what I'm doing. That's rural Venezuela. The name of that town is San Antonio del Golfo. It's very poor. It continues to be poor. 80% of the people in Venezuela are poor. And we have more of the same. We can, if you want to know about Venezuela, we can do it open space this afternoon. When I was practicing medicine in Venezuela, one of the most frustrating experiences was to see the same kid over and over with a different diarrhea every week. And to see tuberculosis and people, and then to see people without water, without this, and things that we take for granted. And same diseases, same thing, 85% of the things that I used to see were the same thing over and over. And one day I said to myself, that's not what I want for my life. I don't want to be seeing the same kid with a different diarrhea every week. That's not what I want. But I also was seeing something very good in Venezuela back then. I was in charge of a team of people that were called community health workers, or promotores. Promotores is the word in Spanish. And these community workers were people from those towns, people with high school education or less, with a training that were able to actually prescribe and take care of a lot of situations in those remote areas in my rural Venezuela. And it was unbelievable to see how they could have all the kids in town immunized using a system with a shoe rack and index cards that were created with cardboard from boxes from Tide the powder. So you had a list of cards, Pedrito, Luisito, Mario, Juancito. And these promotoras would go house by house, knocking at the doors and asking people to bring the kids forward. Tráeme a Pedrito, tráeme a Luisito, because he's due for his vaccine. And then the interaction with the families in the town. The parents would say, well, he's sleeping. And the promotora will say, well, I really don't care. Bring Pedrito because he's due for the vaccine. Pero está durmiendo. I really don't care. Bring me the kid. I'm busy. So, it was like this. I'm your comadre. I'm your neighbor. And we had fully immunized towns. But I work in Orange County where you have a lot of technology and you have even a Mickey Mouse there. And we have a lot of kids without vaccines. And you can think about this and think in many factors that are influencing these outcomes. But I decided to believe in one thing. I decided to believe that what makes the difference in the health or the advocacy or in putting pressure in institutions to change things was your ability to participate. And I think that the most important behavior that we need to encourage people to develop is to participate. Now think about it. The World Health Organization talks about primary care and the Declaration of Primary Care of Alma-Ata, in which they said that the majority of the people in the world do not have access to services. And they also said in 1978, in that declaration, when they said health for all in the year 2000, they said that the most important worker that we need in order to improve access is a community worker. And they say that because it is the community, the one that has not only the responsibility, but the real power, even if they don't know it, to change things. So the World Health Organization also talks about healthy cities, which is the model that we embrace in Latino Health Access. People talk about healthy cities and they say, I want to live in a healthier city. I want to have a healthy city. But what is that? That could be just a conversation between you and I, or could be a framework that guides policies and programs and strategies. So Healthy Cities actually is a strategy and is a framework that has principles and steps and components. And one of the main components is that you cannot have a healthy city unless you put together different sectors on a table. And those sectors come up with a plan of action. And those sectors include, the people that are doing business, and the people that are doing education, and the people that are doing healthcare, and many others, including the community. Since this framework started going around the planet, the member that has been absent in that table has been the community. Because the mayor of that city in Liverpool, where this model was very popular and continued to be, well, the mayor gets paid to be in the table. And the people from the city and the people from the college also, they get paid. I mean, they go to the meeting and they still get paid. But the community members do not get paid. And in order for Mrs. Martinez to go to a meeting, she will have to stop one day of work, which means the food of her kids. So for her, it's a luxury to participate in that type of event. I mean, think about this conference. There are people downstairs with their computers drinking coffee, watching me, hello, watching me, because the people that put together this conference thought, how do we make them participate? They are busy. They need to send emails. Well, we're going to put a room for them so they can send emails and participate at the same time. Well, how convenient. But for the community, that doesn't work like that. We don't say, okay, let's get the farm workers. We are going to get a room for the farm workers while they pick a strawberry. They can also participate in this healthy city strategy. So it doesn't work. So the more and more I got involved into this, I realized that the community is not going to be involved. It's not going to happen unless we purposely design mechanisms for their inclusion and their participation. It has to come like that. So, and if we don't do it, what happens is that we get a bunch of policies that are approved that nobody implements in my community. We get laws we get issues of housing that shouldn't be happening, but they happen because our community doesn't have a voice. It's very disorganized. They don't know their rights. Many of them are immigrants. Many of them do not have documents. Many of them are very afraid. Our communities are disconnected. The city is very imbalanced, pays attention to the people that give money for them to be reelected, and we don't count. And we will not count unless we participate. So Latino Health Access decided that we want to improve participation so we can have a change that we own. Because we talk about change and this momentum, I do believe in change, and I'm very hopeful, I'm very optimistic, but I think that change requires for people to think and for people to engage in action. What we are doing here is a luxury. So we need to somehow figure out how we invite communities to think and to have the time aside to create a space for Mrs. Martinez y el señor Rodriguez and the people that make tamales and the people that clean houses to think. Otherwise, we continue to focus on issues that are great and are very successful. When the issue is gone, people are gone because they are not in here to transform their lives. They are here to just solve that issue. We are here to solve many issues. We have learned how to participate. That's why we are here. And we believe in this, and we believe in changing the nation and the world. But many people just think about how to get food on the table. So this is a little bit of what we have done. Okay, this is about Orange County. This is my team, part of my team. We employ people from the community. They are, again, called promotores. People that have diabetes and are in charge of the diabetes program, people that have been victims of domestic violence and now they run our strategy against violence, men that were in drugs and now they are teaching men the honor of respecting and healing their communities. We have elders reaching elders. We are teaching immigrant women how to read and write so they can really practice the role of leadership that they deserve. My team has 32 community workers, people that live there and now have a job They are paid, they have salaries, and their job is to transform their communities. So this whole deal about you can get the community as volunteers, but you don't have to pay them, we need to rethink that. This whole thing that if a promotor gets paid, he wouldn't be loyal to the community, I challenge each of us and our own loyalty. I get paid to do my work. So if you cannot trust that the community can be paid and do the job, you cannot trust that I can do that job, or any of us for that matter. But I also have a technical team. You have people there with masters and PhDs, and you have an administrative team, because the idea is to create an institute of community participation. That's what Latino Health Access is. Latino Health Access is an institute through which we are learning to participate, and we are learning why people do not participate so they can be included and organized. And there are many reasons why people don't participate. And people tell me, well, America, but is it true that they don't participate because they are afraid? Or is it that their husbands don't let them do it? Or is it this, is it that? Well, it's a lot of things. You know, people do not participate because they have had horrible experiences in the past, because they don't have time, because they don't trust you, because whatever, because they went to that place once and they were mistreated, or whatever. There are zillions of reasons, and the right answer is to focus on their reasons. So if the reason is that it's not relevant for them, make it relevant. If the reason is lack of time, then how do we find time? We are answering everything. I mean, the most progressive group will answer everything. Well, let's provide childcare and transportation. Well, that's not the reason why they are not participating. The reason is because they have had horrible experiences with other groups, even if you provide childcare. So let's try to create projects in which they could have good experiences, and then again start participating. So this is our children initiative, where we have 185 children and youth as promotores. These are community workers. Our youngest promotor is 6. And these kids are learning to participate by doing outreach, by talking about apples and exercise, and things that are not fair. And promotores are great leaders, and when we include the community in working to transform their own communities, you work with the community twice. They are your employees, so they are trained inside, and then they are outside again in the community because they live there, and it's a great role model for others. Promotores do outreach, they work on health fairs, they work in cultural things. I mean, we cannot separate our communities from our culture, and people are really very united around this. We believe that knowledge shouldn't be a monopoly. So when people say, why you have community workers in diabetes? Because diabetes belongs to all of the people with diabetes. This is not a doctor thing. Mental health is not a psychologist thing. So people should have the right to know more and to practice what they know and to help each other with that knowledge. They manage data, they share data and do capacity building, they teach classes. They support people in the community. They do fundraising. Here they are making tamales to pay for eye surgery for people. Kids get organized to fight liquor license, and sometimes they win, sometimes they lose. Right now we are fighting for an alcohol moratorium. This is our domestic violence project. We don't have a center. We rent a place. There is not a single park in that area of Santa Ana for 65,000 people. This is a laundry place where they are meeting with a group on domestic violence. We take people camping and retreats so they can think about change, and we find the space for them to bring their families, and we take care of everything else so they can join the reflection and the dialogue. We have many programs, but this is the one I want to share in the final minutes that I have. We don't have a place to play. Our communities are very sick. The design is very sick. Our communities are designed to be sick. So Santa Ana doesn't have a lot of open space, and for sure the area where we have our major initiative doesn't have a lot. It's 0.5 acre per 1,000 people. This is something that is called a park in Santa Ana. And I laugh about this because the only only sport that you can play in that park is theoretical basketball. So this is what we see in our communities, are the kids in dumpsters and a lot of dropout and people overcrowded, living in a living room, buildings that say that people cannot play. This is also in the same building. Moms that taking care of kids in Newport while our kids are alone. And there are other kids taking care of these kids, and that's why the Children Initiative is so important, because children are caretakers in our community. And then, fighting the whole national picture in which marketing is targeting our kids without any type of mercy. So what we do, we teach people about food. We find places in churches, no matter where, so people can exercise. We train women because they want to exercise. They want to look pretty, and we invite them to be pretty. But then we train them as leaders. And once they get awareness, they are trained, and then we recruit them. And some of those women already are community workers in my program, leading the strategy for healthy living in Santa Ana. So these moms have been organizing to get a park, a first park in that area. And after several years, this is Araceli, now one of our promotoras that started as a mom in the project. She's there giving testimonial in city council about the lack of parks. These are our children promotores, in the meantime, training and also giving testimonial in city council about how unfair it is that they cannot ride a bike, in their own terms, in their own way. This is the piece of land that we got. We fought for it. It's half acre. And finally, we have the first park for that area of Santa Ana. St. Joseph Hospital was the partner. It has been a lot of work. These are the drawings of what is going to be the park. Thanks to the California Endowment, we have a great coalition transforming schools, transforming the health department. We are proposing a tax measure to fund the schools so they can open, the schools close after hours. We are training the youth in fighting for a safer city. This is the latest meeting that we had with 280 people in a gathering, just people from the community discussing the issues of safety, lack of open space, etc. in Santa Ana. And I wanted to highlight that woman that is facilitating one of the groups in the gathering was a victim of domestic violence, was a volunteer with us, is now one of our promotores working in the domestic violence program. And now she's facilitating for her own community to be part of this dialogue. And this is her facilitating one of the groups. This is our program on inviting Latinos to become citizens. We have created our policy department 3 years ago. Now we are working with NALEO to mobilize the Latino vote as part of our health strategy. I just want to share with you one good news is that Santa Ana doesn't have data on health. The cities in Orange County do not have data. The data belongs to the county, to the public health departments. As long as that happens, we will not be able to make these cities accountable or be able to create a plan to become a healthier place. For 15 years, we have been trying for the mayor of Santa Ana to open up to the idea of becoming a healthy city and committing himself to that purpose. This year, we are going to be 15 in August. And the mayor, in our last meeting, said that he wants that data, and he's joining us in the creation of a healthier city. How that is going to happen, because we are there, but it's very good to happen because Latino Health Access alone cannot make Santa Ana or Orange County a healthier place. We have understood that we need the city, we need the national partners, we have joined them, and hopefully we will have better stories to tell in the future. Thank you very much.